Hi everyone, my name is Ced. I have a question for you. Have you ever tried smoking? If no, good for you. Smoking can cause to a lot of severe and chronic conditions like cancer, lung disease, heart failure, and so on and so forth. Smoking doesn't just affect the user, but it can also affect others because of the secondhand smoke. As early as possible, try to avoid it, not do it. There is a study that says 200 Filipinos die every day because of smoking. As early as now, quit from it, not do it. It will not cost you anything positive in the long run. Based from the Philippine statistics, there are 17.3 million Filipino adult smokers. 48% from this are males and 9% are females. According to our report, 200 Filipinos die every day because of smoking. Tobacco use is responsible for 6 million preventable deaths worldwide annually, with many of these deaths occurring prematurely. Based from World Health Organization, an additional 600,000 people are estimated to die from being exposed to secondhand smoke. The Philippines ranks second in number of smokers and has the highest number of female smokers in the 10-member Association of Southeast Asian Nations. People say that they use tobacco for many different reasons, like stress relief, pleasure, or in social situations. One of the first steps to quitting is to learn why you feel like using tobacco. Then you can think about the reasons you want to quit. The biological factors involved in smoking relate to how the brain responds to nicotine. When a person smokes, a dose of nicotine reaches the brain within about 10 seconds. At first, nicotine improves mood and concentration, decreases anger and stress, relaxes muscles, and reduces appetite. Regular doses of nicotine lead to changes in the brain which then lead to nicotine withdrawal symptoms when the supply of nicotine decreases. Smoking temporarily reduces these withdrawal symptoms and can therefore reinforce the habit. Nicotine is out of your body 72 hours after you quit smoking. Nicotine withdrawal symptoms usually reach their peak 2 to 3 days after you quit and are gone within 1 to 3 months. There are a lot of effects of nicotine in our body. This causes the addiction that can range to severe and chronic conditions such as lung cancer, heart disease, fertility problems, pregnancy complications, type 2 diabetes, weakened immune system, vision problems, and poor oral hygiene. When tobacco is smoked, nicotine rapidly reaches peak levels in the bloodstream and enters the brain. Immediately after exposure to nicotine, there is a kick caused in part by the drug's stimulation of the adrenal glands and resulting discharge of adrenaline. The rush of adrenaline stimulates the body and causes an increase in blood pressure, respiration, and heart rate. Like other drugs, nicotine also activates reward pathways in the brain circuitry that regulates reinforcement and feelings of pleasure. There are a lot of dangers of smoking. Smoking is addictive. Nicotine is a drug that is naturally present in the tobacco plant and is primarily responsible for a person's addiction to tobacco products, including cigarettes. Smoking is a leading cause of cancer and death from cancer. It causes cancers of the lungs, esophagus, larynx, mouth, throat, kidney, bladder, liver, pancreas, stomach, cervix, colon, and rectum. Smoking causes heart disease, stroke, diabetes, osteoporosis, arthritis, cataracts, and worsens asthma symptoms for adults. Smokers are at a higher risk of developing pneumonia, tuberculosis, and other airway infections, and smoking weakens the immune system. Smoking makes it harder for a woman to get pregnant. A pregnant smoker is at a higher risk of a miscarriage. A woman who smokes during or after pregnancy, increasing her infant's risk of death from sudden infant death syndromes or SIDS, and men who smoke are at a greater risk of an erectile dysfunction. Let us all work together to have a smoke-free community. Smoking kills. Quit smoking before it's too late. A friendly reminder from the Graduate School of San Pedro College of Davao, class of Dr. Rosada.